Hello, thank you for having a look at this podcast. My name is John Rees. I'm a chiropractor and personally I'm based in Ilkley in West Yorkshire. I'm currently doing a series of films, videos, podcasts, call them what you like, to try and inform people a little bit more about chiropractic, either generically or in this particular video we're going to be a bit more specific about one particular condition that we do see on occasion that we do treat. The condition we're going to talk about today is sciatica. Now, sciatica is a word and a term and a condition that's bandied about very regularly, and it is often misused, and quite naturally patients can get confused because of the terminology used. In its simplest sense, all that sciatica is, it is a medical word, it is a Latin word for leg pain. So anytime you have leg pain, you have sciatica. Now, there are many reasons why you can have leg pain. Some of them can be very simple and can be corrected very quickly, very easily, only a few treatments. Other times it can be a little bit more invasive and problematic and take a much longer time frame to improve. Now, the confusion comes about, and it's understandable from everyone's point of view, but particularly from a patient's point of view, particularly as we in the medical profession seem to love to use Latin words as opposed to talking in plain English to our patients. And the reason there is confusion is that there is the sciatic nerve, which, like the femoral nerve, goes down the leg. The sciatic nerve goes down the back of the leg, the femoral nerve goes down the front of the leg. And therefore, when people hear the term sciatica, it's quite natural for them to believe that the leg pain, the sciatica, is coming from an irritation of the sciatic nerve. That is one cause, but it is not the primary cause, and it's definitely not the sole cause. But to give you a bit of an explanation as to what happens when there is a problem with the sciatic nerve, the sciatic nerve is made up of 5, sometimes 6, what we call nerve roots. So if we can contextualize it, if you look at the diagram over here, what you'll see is a plan view of a vertebra. So the bit at the top you can see is bone, and then behind is a sort of ring of bone, and there's a hole in the middle. Now that bone is one of 24 vertebrae that make up the bones of the spine. And then if you look at this diagram, you will see them stacked up one above the other, as I say, 24 of them. And the diagram on this side is a side view of the lumbar spine, and at the front you can see the thickness of the vertebra, the bone, and then towards the back you'll see at each level a hole, and then just in front of that hole you'll see in the sort of light grey, that is where the disc is. Okay, so when you look at this next shot, which is exactly the same view as this one, showing the side view, and on this one here the side view is without the nerve roots. On this side you can see where the nerve roots, the yellow circles are, if you like, and that's the nerve roots that come out in the lumbar spine, and then 5 or 6 of them amalgamate to make the sciatic nerve. Now what we will see here is a diagrammatic representation of a sort of cutaway of the back of the spine, and if you see at 2 different levels you'll see some dotted black lines making up a circle, and that illustrates where a disc can bulge backwards, and then if you see the purpley, purpley sort of diagrammentation of a nerve, you can see how therefore the nerve root is impinged upon by the disc. And that's the basic premise of an issue caused by a disc bulge of the nerve roots of the sciatic nerve. And as we said before, because depending on where the disc bulge is and depending on which of the nerve roots is pressed upon or impinged upon, we get a good idea as to where, from the symptoms patients shown us, which nerve root that relates to. It is a complaint most common in people from the age of about 25 to 45, because at that point the discs are much more turgid than they are later in life, and therefore they can bulge more readily. And also at a younger age, people are more likely to be doing activities that might cause a stress or a pressure in that area and therefore cause the disc to bulge. Then the positive thing from our point of view, because each of these nerve roots comes out at a particular level, and each of these nerve roots services a particular part of the leg and the foot. When a patient tells us what their symptoms are, if they are from an irritation of the sciatic nerve, we know which level of nerve roots have been affected, and therefore we can look to treat accordingly. Now, there are a number of variable prognoses with regard to irritation of the sciatic nerve, and some can respond very well to chiropractic treatment. Some, unfortunately, may, at the worst case scenario, end up in requiring a surgical intervention. However, what one must always consider and realize is that just because one might end up with a surgical intervention does not provide you with 100% surety that the problem will be resolved. So one should, if one is ever thinking of that as an option or discussing it with a clinician as an option, one should be well aware that it doesn't necessarily 100% secure you with the reduction in the symptoms totally that you feel a surgery might do. Chiropractic care will and can and has done assist treatment of irritation of the sciatic nerve. It's often numerous treatments over quite a lengthy period of time, and one of the unfortunate things with a sciatic nerve irritation is that you can be progressing very well over a number of weeks, a number of months, and then unbeknown to yourself you can undertake a certain activity and you can reignite the symptoms, and therefore it can be quite a psychological hit to be improving, only to find you feel you're almost back to stage one. But that is the sciatica as a result of a problem of the irritation of the nerve roots that make up the sciatic nerve. Similarly, you can have a problem on the front of the leg based more to do with the femoral nerve. It's less common, but it can happen. But one must be quite categoric. Leg pain and the causations of leg pain are much more common with for other reasons. Muscle tightness, muscle stiffness in certain parts of the low back and the leg and the buttock area can also give you sciatica, leg pain. Irritation or restriction of certain joints, particularly in the lumbar spine and the pelvis, can similarly give you a leg pain. Problems with the hip joint can also do that. Problems with the knee can also do that. And more often than not, these other causes, these other reasons for your leg pain, your sciatica, are much more likely than they are to be an irritation of the sciatic nerve, which is a positive scenario. Also, as we've said, the most common age for an irritation based on the disc issue is between the ages of 25 and 45. So those who are older can get an irritation of the sciatic nerve, but it will be for another cause, and oftentimes it's because the joints that are associated to and the apertures associated to the point at which the nerve root comes out of the spine get smaller as bones wear and we age, and there is less tolerance around the system. And there are a few other reasons for that. But just to reiterate, the main cause of leg pain is not an irritation of the sciatic nerve, as many patients think, and actually certain clinicians who aren't properly musculoskeletal trained will think. If you have any queries, if you want a bit more conversation about some symptoms of leg pain that you may have, please feel free to give us a call. Our contact details are up here, and we look forward to hearing from you as and when is necessary. Thank you very much.